Let's talk about pain. Everybody feels it, but how we treat it is a whole different ballgame. It's helpful to think of pain medications less as a one-size-fits-all pill and more like a specialized toolkit. So today, we're going to open up that toolbox and figure out what each tool is for, when to use it, and how to use it safely. I mean, seriously, we've all been there, standing in the pharmacy aisle, staring at the boxes and thinking, what's the actual difference? They seem like they do the same thing, but trust me, they are fundamentally different tools for very different jobs. Nailing this is really the first step to becoming a pro with your pain management toolkit. So here's our game plan. First, we'll get into the basics, sorting out the difference between those everyday painkillers. Then we'll check out some specialist tools for really specific problems, like migraines. And finally, we're going to tackle the most powerful tools in the box, opioids, and, just as importantly, the safety net that absolutely must go with them. All right, let's start with the tools you probably have in your medicine cabinet right now. They're the hammers and screwdrivers of pain relief, but do you really know what's going on when you take one? Okay, so this is the family that includes stuff like ibuprofen and aspirin. They're called NSAIDs, and they work by blocking these enzymes called COX. Now, blocking COX means your body makes less of these things called prostaglandins, which are major culprits in causing pain, fever, and inflammation. So you get this awesome 3-for-1 deal: pain relief, fever reduction, and it calms down swelling. And then we have acetaminophen, which you probably know as Tylenol. It also blocks those COX enzymes, but it mainly does its work in your central nervous system, so your brain and spinal cord. But here is the absolute key difference, the part you have to remember. It has practically no anti-inflammatory effects. It's fantastic for a headache or a fever, but for a swollen, sprained ankle, it's not the right tool for the job. And this chart just lays it all out perfectly. See that check mark under anti-inflammatory? That's for NSAIDs only. But then, look at the risks. NSAIDs can be tough on your stomach and your kidneys. Acetaminophen, on the other hand, its biggest risk is to the liver, especially if you take too much. This is exactly why you can't just swap them out without thinking. And this is a perfect example of why that matters. Even within the NSAID family, some tools are way stronger. Ketorolac is a super potent NSAID, and because of that risk to the kidneys we just saw, you absolutely cannot use it for more than 5 days, period. And on the flip side, here's the most serious warning for acetaminophen. When you use it correctly, it's incredibly safe, but taking more than the recommended dose is the leading cause of sudden liver failure in the US. It's a huge reminder that even the most common medications need to be treated with respect. Okay, we've got the everyday tools down. Now, let's dig a little deeper into the toolbox for the specialist equipment. Sometimes a simple hammer won't do. You need a tool that's built for one very specific job. Anyone who's ever had a migraine knows it is not just a bad headache. Triptans are the specialist tools for this job. They target serotonin receptors in the brain, and that causes the swollen blood vessels to narrow back down, which can stop a migraine right in its tracks. And with these, timing is everything. This is not a pill you take every morning to keep migraines away. Think of it as a rescue medication. You use this tool the second you feel that migraine coming on, not before. It's for stopping an attack, not preventing one. Now, when you need to bring out the big guns to fight inflammation, you're talking about corticosteroids, like prednisone. These things are unbelievably powerful anti-inflammatories. We're talking everything from a severe asthma attack to reducing the swelling around a brain tumor. They're so strong they can even suppress your immune system. But because they're so powerful, you can't just quit them cold turkey if you've been on them for a while. Your body stops making its own natural steroids, so you have to slowly reduce the dose, taper it, to give your body a chance to wake up and start producing its own again. It's a critical safety step. All right. Time to talk about the power tools in our kit. For severe pain, nothing works like an opioid. But just like a chainsaw or a nail gun, they demand the absolute highest level of caution and respect. So how do they work? Well, opioids lock on to these specific docking sites in your brain and body called mu and kappa receptors. And when they connect, they basically put up a roadblock, stopping pain signals from getting through. The result is really powerful pain relief, or analgesia. And I'm sure you've heard of a lot of these names before. We've got morphine, which is kind of the classic opioid. Then there's fentanyl, oxycodone, codeine. This list covers a lot of the common ones used to manage really severe pain. Now, if you want to understand just how potent we're talking, look at this. Most drugs, right, are dosed in milligrams. That's 1,000th of a gram. Fentanyl is so incredibly strong it's dosed in micrograms. We're talking millionths of a gram. That's a huge difference in power, and it really shows the kind of strength we're dealing with here. So with that kind of power comes huge responsibility. The single most dangerous side effect of opioids is that they can slow your breathing down to dangerous levels. That's why monitoring breathing before, during, and after is priority number one. And all these other alerts, giving IV doses slowly, managing constipation, they're all part of the essential user manual for these power tools. Because we're talking about power tools, you have to have a safety net. You wouldn't use a table saw without a blade guard, right? This last part is all about the essential gear and the rules that make using opioids safer. And this is the emergency stop button. Naloxone, which you might know as Narcan, is an opioid antagonist. Think of it like this. It rushes into those mu and kappa receptors, physically kicks the opioid molecules out, and then blocks the entrance so they can't get back in. This rapidly reverses an overdose and gets the person breathing again. And if you ever face an emergency, the steps are straightforward and simple. First, try to wake the person up by shaking them and shouting their name. If there's no response, you call 911 right away. Then you administer the naloxone, and crucially, you stay with them and monitor them until help arrives. Now this is a massively important warning. Naloxone is great, but it wears off in about 30 to 90 minutes. Many opioids, though, can last in the body for much longer. So what can happen? The person can wake up, but then slip right back into the overdose after the naloxone is gone. That's why continuous monitoring is non-negotiable. And finally, here's a really smart piece of safety tech used in hospitals. A PCA pump actually lets the patient control their own pain medicine by pressing a button. But, and this is the genius part, it's programmed with strict safety limits. There's a maximum dose and a lockout time so they can't accidentally give themselves too much. It puts them in control, but within a safe boundary. So we've gone through the whole toolkit, from the basic stuff in your cabinet to the heavy-duty power tools. And if there's one takeaway, it's this. The key isn't just knowing what the tools do, but knowing when to use them, and maybe more importantly, when not to. So after all this, what's the one safety check that's really going to stick with you?